Let's go live now to Gabriella Power in Melbourne. Gab, the Prime Minister made a landmark commitment to fighting this virus outbreak.
Danica, Prime Minister Scott Morrison has just announced a federal and state funding agreement to deal with coronavirus. It is a standalone agreement and the cost will be split 50-50 between the federal government and the states. The Commonwealth will be putting down $100 million as an advance, and the expenditure relates to costs from the 21st of January. It is expected that the coronavirus could cost $1 billion, and the government is upping its usual commitment to a health crisis, giving the unprecedented nature of the outbreak. Prime Minister Scott Morrison says that this should give Australians some assurance.
The current hospital arrangements is a 55-45 split. The Commonwealth normally pays 45. We're upping that to 50% as part of that arrangement. And it normally, if you've got a public health response in a aged care facility or in a childcare facility or something like that, normally the states pay 100% of that public health response in those areas, and we'd be very happy to shoulder those costs 50-50 with the states because of the serious nature and very specific nature of this virus.
The Aged Care COVID-19 Preparedness Forum will be taking place in Canberra later this afternoon. Health Minister Greg Hunt will be meeting with 70 representatives across the aged care sector, and it comes as many Australians have concerns about relatives living in aged care facilities after a 95-year-old woman from a nursing home was the second coronavirus fatality. Now, Paul Kelly, the Deputy Chief Medical Officer, says that it's critical they have this meeting today.
In terms of aged care facilities, what we know from around the world, with almost 100,000 cases now and over 3,000 deaths, is that people that are elderly and people with other diseases, chronic diseases like diabetes, heart disease, lung disease and cancer, are more vulnerable to this virus. They are the ones that get the more severe end of the spectrum. For most people that get this infection, it will be like a cold or a mild flu. For older people, it's a particular issue. There are other issues, of course, in aged care around dementia and the ability to use personal protective equipment, both for the staff and also for people that might be affected in those communities. So that is a particular challenge, and that's why we're having the meeting today.
Health Minister Greg Hunt says that this meeting today is about taking the next steps in protecting older Australians. Danica?